we will see about the Norma verticalis, that is the superior view of the skull. The superior view of the skull appears to be oval in shape, being wider posteriorly than anteriorly. The bones present in the Norma verticalis are frontal bone anteriorly, parietal bone on each side, and the squamous part of the occipital bone posteriorly. What are the sutures seen in this view? These are the coronal suture. Coronal suture is the suture present in between the frontal bone and two parietal bone. It cuts the cranial vault side by side and it is directed downward and forward. This is the coronal suture. The suture present between the two parietal bone is the sagittal suture. It is a type of serrate type of a suture. So, intersecting point present between the coronal suture and the sagittal suture is called as the bregma. And in fetal skull, this is the site for the presence of the anterior fontanelle. So, here is the bregma, at which in the fetal skull presence of a membranous gap is called as the anterior fontanelle, which get closes at the age of 18 months to 2 years. Next, a suture present between occipital, squamous part of the occipital bone and the parietal bone is called as the lambdoidal suture. It is a type of denticulate suture. Intersecting point of the sagittal suture and the lambdoidal suture, it is called as lambda. And this is the site in the fetal skull for the posterior fontanelle, which get closes at the age of 2 to 3 months. The highest point on the sagittal suture is called as the vertex. In few subject, that is 3 to 8% of the subject, metopic suture is present, which separates these two half of the frontal bone. These are present in only 3 to 8% of the subject. In the fetal skull, we can see the metopic suture over here, which is present between two frontal bone. In adult, it get ossified, but in 3 to 8% of the subject, it remains as it is. 2.5 to 4 centimeter in front of the lambda is the presence of the parietal foramen, which transmits the emissary vein. And emissary veins, these are the connecting veins which connect the extracranial veins with the intracranial venous sinuses. So here it connects the superior sagittal sinus. It maintains the pressure, intracranial pressure. A point on the sagittal suture in between two parietal foramina is called as the oblivion. So this is the oblivion point. The point of the maximum convexity on the parietal bone is called as the parietal tuber. And this is near to this parietal tuber is the site, is the center for the ossification of the parietal bone. So ossification, it spread centrifugally, because of which the margin it ossified first as compared to these four angles of the parietal bone. So because this is the reason why the anterior fontanelle or the membranous gaps, they are present at the four angles of the parietal bone. This should you know. So parietal tuber is again a site for the common site for the fracture. Now on the parietal bone, in the Norma verticalis itself, we can see these two lines. These two lines are the superior and the inferior temporal line, which begins at the zygomatic process of the frontal bone. So here you can trace it backward by crossing frontal bone, coronal suture, and on the parietal bone, there are the presence of the two lines. Superior temporal line, which fades away, and the inferior temporal line, it goes downward and then forward like this. So these are the few points about the Norma verticalis.